Hi, we're Analy.
And I'm Melissa, and we are your navigators for the 2022 Marketplace. So, what is a navigator? A navigator is an individual who is trained and able to help consumers, small businesses, and their employees as they look for health coverage options through the marketplace. We help with Medicaid, Medicare, of course, going through the marketplace, and financial assistance for those who do not qualify for health insurance either through Medicaid, Medicare, or the marketplace. And this financial assistance is offered at one of our 5 clinics.
We will explain what the marketplace is and the steps to getting healthcare coverage. We'll be doing an overview of the marketplace. We'll be discussing special dates and special enrollments, define who might be eligible for the marketplace coverage, describe the enrollment process, define what a premium tax credit is, go through health insurance options, and locate resources and assistance for you.
So, applying for coverage. So, consumers can apply for coverage either through the marketplace, they go through healthcare.gov. They can either go through some marketplace plan issuers, marketplace call centers, which the number's on the screen, a marketplace enrollment assister, a marketplace registered agents, broker or web broker sites, or paper application.
Now, the Marketplace call center is open 24/7. So if you do have questions at any time, you could call them at any time during the day and they will definitely be able to assist you with any of your questions. Important dates to know. So the open enrollment for the year of 2022 did open November 1st, and it is open until January 15th for the following year. If you have already enrolled into an insurance plan before the 15th of December, your insurance is estimated to have an effective date as of January 1st. You do still have time, however, to still enroll before January 15th to have an effective date for any health plan coverage starting February 1st of 2022. In case you are not able to enroll within this open enrollment window, there are certain circumstances that allows you to be eligible for a special enrollment. These certain circumstances can be changes in household residence or loss of health insurance through an employer or state benefits. Other changes can be becoming a U.S. citizen. There's a list of certain exemptions that qualify for use for special enrollment. So if you kind of want to know if your circumstance does qualify for you, you can visit the healthcare website or you can give us a call and we'll just assess you. Now, the special enrollment allows you 60 days before and 60 days following an event. So you do have a good amount of time to use an actual event to come back to the marketplace and make an enrollment or just apply and see what options are being offered to you.
Now, the application process. So you can either apply in the marketplace coverage online, by phone, or in person with a trained assessor. Your marketplace application will ask you about each person in your household, even those who you are not applying for coverage for. It's going to ask you questions about your employer, your income, your healthcare information, coverage information, and it's also going to bring you through an identity verification process.
Who is eligible for coverage to the marketplace? To be eligible, individuals and households must live in the United States in a state that is served by the marketplace where they are applying. They must be a U.S. citizen, a U.S. national, or a lawfully present immigrant for the entire time they plan to have healthcare coverage. Must not be incarcerated unless pending charges. If you don't see your immigration status on this list, there is another profound list where we can actually go in more detail. If you do have questions, once more, you can give us a call and we can definitely assess you to see if you are those among eligible for coverage to the marketplace.
Now, your health insurance options. So you have several options, and they would help you find health coverage that fits your budget and meets your needs. When you apply for coverage, you can see all your options and you're able to enroll online. Every health plan in the marketplace offers the same set of essential health benefits like doctor visits, preventive care, hospitalizations, prescription drugs,
Mhm.
emergency room visits. You can compare plan based on price, benefits, and other features important to you before you make a choice.
What is a premium tax credit? A premium tax credit, also known as PTC, is a refundable credit that helps individuals and families cover premiums for their health insurance plans through Health Insurance Marketplace. To get this credit, you must meet certain requirements and file a tax return. Certain household incomes who aren't eligible for coverage through a job, Medicare or Medicaid, may be eligible for much savings through the marketplace. Consumers must project what their annual income can be for the year of 2022. If this income falls between 100 or 400% of the federal poverty level, they may qualify for what is called a premium tax credit. To give you an example, if you're a family of household of three, your income may be less than 87,000 per year, and you and your family can qualify for a premium tax credit. These tax credits are only available to consumers who enroll in individual marketplace plans through the marketplace. To be eligible, you can use all of the premium tax credit or just some in order to lower your monthly premiums. These are also known as advance payments of the premium tax credit. If a consumer is ineligible for Medicaid, maybe due to their immigration status, you may still qualify and enroll in a marketplace health insurance plan if your income is less than 100% of the FPL guideline. We can definitely help you forecast what your annual income will be for year 2022. We do ask for proof of income to assist you in projecting what your annual income can be for the following year. To continue, reconciling advance payment tax credits. The amount of the premium tax credit a consumer is eligible may change throughout the coverage year. It can change due to changes in the household, such as changes in income, household size, or any other determining factors. It is very important if you have any changes of the household, you must call the marketplace and report these changes just to make sure that your premium tax credit determined it is correct. When consumers file for their taxes, they have to reconcile for these advanced tax premium credits that were paid on their behalf to reduce their monthly premiums with the amount that they're ultimately eligible for based on that household projected household annual income. If you are to use it in excess over what was determined for, you may be required to pay all or just some of the difference when you're actually filing for taxes. If you use less of your premium tax credit, you may be able to get a refund when filing for your federal income tax return.
Health plan categories. We have four categories to choose from. There will be the bronze level, silver level, gold level, and platinum level. Each level depend how much your percentage of cost will average for the consumer. Bronze level, you will pay 40% of the cost. Silver level will pay 30% of the cost, gold level 20%, and platinum 10% of the average of the cost.
Marketplace plans. Marketplace plans must include essential health plans, follow established limits on cost sharing, such as deductibles, co-payments, and out-of-pocket maximums, and must meet non-discrimination requirements, meaning that they cannot ask you if you have any pre-existing conditions, pre-existing health conditions in order to offer you any health insurance plans through the marketplace. If you see on your right, you will see two health insurance examples, such as the policy name, its estimated monthly premium cost, deductibles, out-of-pocket maximums, co-payments for doctors, facilities, and drugs.
Also, if you notice, they have a bronze plan and a silver plan. With the bronze plan, yes, you do pay less. However, if you look to the silver plan, it is slightly little bit more. However, your deductible will be less, your out of pocket will be less, and so will your co-payments and co-insurance. So to get the most out of your premium tax credit, sometimes best to use the silver plan because you'll basically get more for what you pay for.
Again, it does depend if you have certain budgets or
Mhm.
certain requirements or certain services that you are looking for. The marketplace tool allows you to make a comparison of three plans at a time. So in case we will be going through the plans with you to see if there's anything in particularly that meets certain things that you do need, and we'll be going and helping you throughout the process.
So making an appointment is very simple. You can either visit PrimeCare Health. We have 5 primary health locations. Analy is located at the Belmont Cragen location. I am located at the Westtown location. You could go on to primecarehealth.org. You can contact us at 312-633-5841 and ask to speak to our navigators. You can find local help tool through the localhelp.healthcare.gov, and be sure to follow us on Facebook for any updates. You can also scan the QR code on the right of the screen, and it'll give you more information about our locations.
So just give us a call. We do have open slots to schedule an appointment in case you do have questions or need assistance in going through any health insurance plans through the marketplace. Well, thank you, and you guys have a great day.